advice you would give to nurses to help with transitioning them to having to go to therapy or like anything like that to like make the process easier for you guys?
That is wonderful. I love that. That's a great question. So, how can nurses best refer to therapists? So, one, I would say, how can we make it more trauma informed, or how can we be more where we see the need in you as a nurse to the patient and say, you need to go to counseling. Can we do it as a team?
I'm thinking more like how to do it as a team.
Right. And I think sometimes it comes across it's not, right? So it's as a professional, doctor, nurse, see this, I think you need to go to counseling versus you've had some stuff going on. I would love, do you think it could be beneficial to go see a counselor? So now we're sharing that conversation about going versus me as a professional telling you, you need to go to counseling.
So having it as more like a conversation opener.
Yes.
And then if the patient decides for themselves they do, then getting that contact and that connection with the therapist.
100%. And then once there's a buy-in, hey, I really think this could be beneficial. What do you think? You agree? Cool. So there's different avenues on how you can go get scheduled. There's websites, there's your insurance. If you don't have insurance, I can help find you some resources of places that maybe you can go and get free counseling. There's not many, but there are a few. So I think I'm all about how can we work together versus me as a professional and talking to the client and telling them what they need.
That helps. And then for people who are underrepresented or underinsured, how would they find resources? Because everything costs money.
Yes. So a lot of people started at college, so a lot of colleges have some form of free counseling. I always tell them to start there. If they don't have insurance or their insurance deductible is way too high where they can't afford it. I think starting at a college, and if the college doesn't have that resource, they usually have places or resources to send people that could help them. Yeah.
Thank you.
Well, it was very nice to meet you. I appreciate you coming and talking. Thank you so much.
Thank you.
All right.
You should come buy stuff from their fundraiser.
All right, I appreciate it. What's the fundraiser for?